Right, I have 1 o'clock Eastern on my clock, so we're going to jump right in. We've got a full agenda for y'all today. Welcome to today's webinar focused on statewide approaches to support accreditation efforts. I'm Rena Chudgar. I'm the Senior Director for our Public Health Systems and Services team at PHAB, and I'll be moderating our event today. Wanted to start out with a few logistics. We do have everyone on mute today. We are using a webinar format. We encourage you to use the Q&A box, which you can find on the bottom of your screen. If it's not immediately visible, it'll likely be in that More button, to ask your questions, and we'll address as many as we can during the Q&A period towards the end of the call. Today's webinar will be recorded and we'll share it out with everyone who registered for today's event, as well as have it on our website. We also have closed captions available. They can be enabled on the bottom of your Zoom screen. If you click the CC button, as you see on this screen, where it's located might vary based on what version of Zoom you're using. And you can hide the closed captions at any time by re-clicking that button as well. We're really, really pleased to have our wonderful presenters here from Montana, Wisconsin, Nebraska, and Missouri today. We've got Rich and Megan from Montana, Krista from Wisconsin, Celeste from Nebraska, and Ashlyn from Missouri. And as we move into their sections of our webinar today, we'll reintroduce them more fully as we turn it over to them. I also want to acknowledge our PHAB staff who are also on today. We have Emily France as a senior specialist on our accreditation and recognition team, and Ashley Spangler, who is an accreditation specialist on our accreditation recognition team, who you'll hear from throughout our call today at various points. And also want to acknowledge Lydia Argai, who is a program assistant on our systems and services team, who's going to be supporting all of our technical and logistics on the back end. So thanks again to all of y'all and to our presenters for being here today. Our goals for our time together today are really to describe various approaches that are being used to support system-wide or statewide accreditation support and accreditation efforts, and then share specific examples from states, those that I highlighted just a moment ago, and share some resources with you that you can use as you think about any or all of these approaches within your system. And we're really thinking about this in the spirit of how to continue to build a culture of quality and CQI within organizations and across public health systems, and really thinking about how to continually think about enhanced efficiency, effectiveness, and how these different approaches can help support those goals. So dive in a little bit deeper for our flow for today. We're in the welcome and overview portion. I'm going to share some of those statewide accreditation approaches on a higher level with y'all, and then shift into those examples from Montana, Wisconsin, Nebraska, and Missouri to share specifically in those states, what are they thinking about? Then again, share some resources that are available, and then have the remaining time for Q&A and with all of y'all. So please do use that Q&A function. And with that, really just want to acknowledge this is all with grounding in our work as PHAB, as an organization, and our mission to advance and transform public health practice through performance improvement, strong infrastructure, and innovation. And our work at PHAB really around both individual health department centered work and overall system-wide work within state systems and the public health system overall, and grounded in the frameworks that are the foundational public health services and the central public health services. So with that grounding and overview, I'm going to turn now to my colleague, Emily, to move us into more around what are statewide accreditation approaches.
Thanks so much, Rena. PHAB is home to service and resource sharing, and we believe in thinking about how services and resources can be shared across boundaries, whether health department to health department, regional or statewide efforts like the focus of this webinar. These approaches can support enhanced learning, efficiency, and effectiveness to ultimately improve health outcomes. PHAB recognizes that the Public Health Infrastructure Grant, or FIG, and other investments have facilitated new opportunities for collaboration and synergy, particularly between state and local levels. PHAB applauds these efforts and those that are underway by state health departments and others to support accreditation. These efforts demonstrate a commitment to streamlining documentation burden, creating efficiencies within statewide systems, and bringing clarity to the alignment of state and national goals. Today's presentation will highlight a few of these deliberate efforts that states have undertaken recently. And at a high level, several of these statewide accreditation approaches include identifying and submitting statewide documentation, facilitating peer-to-peer engagement and sharing through accreditation learning communities, including pathways cohorts, exploring reciprocity between state requirements and accreditation, establishing documentation libraries, supporting the development of key plans and processes such as the Community Health Assessment, Community Health Improvement Plan, and the Strategic Plan, and implementing statewide assessments such as the Readiness Assessment, Capacity and Cost Assessment, and Workforce Assessments. As you listen today, we invite you to tune in and explore the possibilities that could be implemented within your state. Listen carefully to both the successes and the challenges encountered as you consider next steps. We invite you to also explore whether any of these are untapped opportunities for your state that could possibly be deployed. And beyond those listed on those screen, we look forward to exploring those possibilities with you in greater detail. And I'm ready to introduce our first set of speakers. If you go to the next slide, Rena. So without further ado, pleased to introduce our first set of speakers. On behalf of the Montana Department of Public Health and Human Services, Richard Kent, Public Health Accreditation Specialist, and Megan Gillespie, Local and Tribal Support Specialist. We look forward to hearing from both of you. Montana is also a member of our 21C initiatives and is working to drive the foundational public health services across the state of Montana.
Great, thanks, Emily. Hello, everyone. I'm Megan Gillespie. I'm from the Montana Department of Health and Human Services in the System Improvement Office. Joined on this call today is my colleague, Richard Connect, who is our State Accreditation Coordinator. And I know we have a couple other Montana folks on the call as well, so it's good to see you all. Before we dive into our specific accreditation and pathways to recognition efforts, I want to zoom the lens out a little bit first. And so we're going to start with a high-level overview of Montana's public health system. Montana is a decentralized state, and we have 60 local and tribal jurisdictions. Within that, we have 2 health districts and 8 federally recognized tribal jurisdictions. It's important to note that the activities Rich and I are going to outline today are not required in Montana's statute or code, and so they are voluntary, which we feel shows both the readiness and willingness of our Montana health departments, and we're incredibly proud of them in their efforts. So moving now to our state approach towards reaching accreditation and pathways to recognition, we're going to start with Tier 1 and 2. And I like to think of these as really our building phases. So building folks' confidence and readiness to pursue these activities. So we start with the Foundational Public Health Services Assessment. Montana completed our assessment last summer and spring, summer, and fall. And with that, we went out into in-person meetings in regions, and we were able to get 100% response rate. So all 60 local and tribal jurisdictions did complete our assessment. We're then wanting to use that data to leverage both our strengths and fill our gaps. And so by building off of our strengths, we know what folks are doing well and increasing encouragement of those activities. And then for the gaps, We're doing a systems approach to those, and so within our state system partners, we're able to fill those. So some of our partners include the Montana Public Health Institute, the Montana Public Health Training Center, the Montana Healthcare Foundation, the Office of American Indian Health, and Confluence Public Health Alliance. One of the initial findings from our assessment is that we have a lot of folks that are delivering the foundational public health services, but they lack either formal documentation or written plan, policies, and procedures. And so out of that, we developed a policy and procedure cohort. And so over the next year, we will dive into a different plan, policy, or procedure each month. And so this ranges everything from developing your mission, vision, values, to a branding strategy and communications plan, to strategic planning. So it's the full gamut of plans, policies, and procedures. In addition to that cohort, our office has traditionally provided funding related to community health assessments, improvement plans, and strategic plans. But we know that that's not enough. And so over the last couple of years, we've been able to amp up the technical assistance being provided. We had Prior to COVID, a lot of our jurisdictions had CHAOS CHIP strategic plans, and unfortunately that took a hit during the pandemic, and so we're slowly building those efforts back up. Before I turn it over to Rich, I want to highlight just the importance of FIG throughout all of our efforts. If it wasn't for FIG funding, Montana wouldn't be able to do a lot of these activities. We're not at the top of the list for public health budget or resources, but what we do well is collaboration. And so FIG's allowed us to build off of our collaborations and have the funding necessary to make these dreams and goals a reality. And so with that, I'm going to let Rich zoom the lens in much further and get to our specific accreditation and pathways to recognition efforts.
All right, thank you, Megan. So in Montana, we took part in the statewide documentation pilot, which I believe the tip sheet will be shared with this group. And that pilot essentially allows the health departments to use documentation that was submitted by the state, which can help alleviate some of the documentation burden. Working with Merida, again, because it was a very early adoption of the pilot, kind of looking at some measures, what we decided to do was work on measure 1.2.2 for that domain, which is showing data sharing between the state and local and tribal health departments. I reached out to one of our colleagues, Danny Powers, who's our epidemiology and scientific support bureau. And we looked at the MIDAS system, which is the Montana Infectious Disease Information System. So Danny and I worked together, collected the MOUs between the counties, tribes, and the state, bundled up that package, worked with Merida, looked at the documentation, and formally submitted it for that pilot program, and it was accepted through the life cycle of version 2022, meaning for any county, tribal health department going through pathways or initial accreditation, they will no longer need to submit that documentation. So it will help them during that process. As well as looking at the Pathways Learning Collaborative, that was in collaboration with the Montana Public Health Institute. And what we ended up doing was creating a cohort for 2 years where tribal and local health departments will work towards the official pathways program from PHAB. And just to give some background on that, our first cohort was 5 local health departments and 1 tribal health department. And our current cohort now is 6 local and 1 tribal health department. And essentially we work through the same 10 domains, track 1 and track 2, through the pathways program. And we provide TA on documentation review, and as Megan has shared as well, providing that TA, coming up with those core essential plans, working through pathways. As well as Megan has also shared, nothing is, we don't put any requirements on it, but we do encourage our health departments, once they finish with the pathways cohort, to formally apply for the actual pathways recognition, which all the health departments in our first cohort have done so, and they're on the track for pathways recognition. And what we use in that, what we use in our cohort is connected communities, which connected communities is a higher logic platform where we have created resource libraries. We have all the documentation from other health departments, and they're able to essentially work together, look at submissions, and just have the peer-to-peer connections. We also have resource libraries for templates, as well as just the information continues to grow. And something else I thought to mention as well is for our accredited health departments in Montana, we also do have a monthly meeting where we review, again, the pilot, new up and coming templates, and Joshua from PHAB attends that and does help us just be up to date with PHAB and other information. So that just gives you a little bit of information on what we do here at the State Health Department in Montana. And if you have any questions on the statewide accreditation, I know it's a newer program, a newer pilot, feel free to reach out to me directly and I can help you and give some insight in what we did here in Montana. Thank you.
Thanks so much, Richard and Megan. Montana was the first state to receive approval on statewide documentation, and it is part of PHAB's policy. So if your state uses the same document, let's say it's all the local health departments or tribal health departments follow the state's communicable disease policies or procedures or manual, PHAB will review that documentation once. And then once approved as statewide documentation, the local and tribal health departments or whoever uses that shared piece of documentation do not need to then resubmit the same documents. So very exciting. We know that there's growing interest in that area. If you are interested in speaking with PHAB staff to explore those possibilities in more detail, we invite you to email us at askphab@phabboard.org and would encourage you to reach out to your state health department, engage in some of those discussions to identify what those documents could be. And next, I will turn it over to Krista Kopp, who serves as the Western Region Director in the Wisconsin Department of Health Services, Division of Public Health, Office of Policy and Practice Alignment. Go ahead, Krista.
Thank you, Emily. Good afternoon, everyone. As Emily mentioned, my name is Krista Kopp, and I'm the Western Region Director and Accreditation Program Support in the Office of Policy and Practice Alignment, or OPA, within the Division of Public Health at the Wisconsin Department of Health Services. So I'm excited to share the projects that our office has been engaged in to support accreditation and reaccreditation. And before I get started, I just would like to acknowledge several of my colleagues who have contributed to both this presentation and the work. Kristen Kelm, who's really been leading this effort, Sherry Beck, Amy Perkins, Martha Lopez, Yelena Pradena, and Cassie Greenwood. So thank you to my colleagues. Some of them might actually be on, so thank you. Next slide, please. So these are the 5 areas that OPA is engaged in to support accreditation and reaccreditation that I'll be going in further detail on in this presentation. Next slide, please. So Wisconsin Administrative Rule DHS Chapter 140 outlines the minimum requirements of local health departments in Wisconsin. So Wisconsin is a decentralized state with 84 local health departments and 11 federally recognized tribes. We also have 3 levels of health departments. So we have levels 1, 2, and 3 outlined in state statute, which is unique to Wisconsin. And each health department in the state, or each local health department in the state, is required to be reviewed at a minimum of every 5 years. So Wisconsin Administrative Code Chapter DHS 140 was updated back in, or the update to the rule went into effect in 2019, and it aligns the requirements of every local health department with the Foundational Public Health Services model. So for health departments that are accredited or going through reaccreditation, can choose if they would like to follow an alternate or shorter review process or the standard review process. And the benefit for that is the alternative review process is still a review, but it is expedited and takes into consideration the information already provided to PHAB during the accreditation process that aligns with Wisconsin's Administrative Rule DHS 140 requirements. Next slide, please. So the alternate review process for PHAB accredited health departments has two main components. First, all local health departments are asked about 4 state-specific requirements that PHAB as a national organization does not require. And those include annual performance evaluations, core public health competencies, land use planning, and public health nursing services. So those are the essentially focus areas that of the DHS 140 review for accredited health departments and as they are Wisconsin specific. And then the review also includes any PHAB measures that are not fully or largely demonstrated in the health department's PHAB summary report. So as part of the process, the PHAB summary report is provided to OPA staff in order to conduct the portion of the review. Next slide, please. So OPA staff have created several iterations of crosswalks to demonstrate how PHAB measures meet DHS 140 requirements. And this is just a screenshot of what that looks like. And we have developed them for initial accreditation as well as reaccreditation. And this is what is utilized to inform the alternate review process and where we may or may not ask questions depending on the score for those measures. Next slide. So now I'm just going to shift into our dedicated web page to support health departments. The web page provides links to PHAB's official website, a section to explain accreditation, and also highlights how OPA staff can provide technical assistance to local and tribal health departments throughout the process. The web page also has a newly added section on statewide evidence that has been approved by PHAB. So we also have gone through the statewide evidence process as well. And this we also on our webpage outline the chapter DHS 140 requirements to demonstrate how locals are already essentially meeting some of the PHAB standards and measures, or their work towards accreditation would meet Wisconsin requirements as there's alignment between the PHAB standards and measures and Wisconsin requirements. Next slide, please. So this is just a screenshot of what our web page used to look like on the left, which was really outlined by the specific measure where where the state may have had evidence or could support local accreditation efforts. And now it has been divided into domains, and it's also been updated for readability, clickable accordions, bulleted lists, and just easier navigation that I think more clearly outlines the alignment between the Wisconsin requirements for local health departments and the PHAB standards and measures. Next slide, please. So statewide evidence, so as mentioned briefly, Wisconsin has also recently gone through the process of submitting documentation as part of the statewide evidence process. As part of this process, documentation needed to show that all 84 health departments in Wisconsin were utilizing. As Emily and others from Montana have already mentioned, that this reduces required documentation submissions for health departments going through or initial accreditation. So examples of some of the documents that Wisconsin provided related to our Wisconsin Electronic Disease Surveillance System, the Wisconsin Immunization Registry, our State Lab of Hygiene capacity, childhood lead screenings, and other statewide trainings that have been provided. Next slide, please. So this brings us to our funding support efforts. So over the years, OPA has heard from local health departments that funding is one of the reasons that they have not approached or are not seeking PHAB accreditation or have opted not to seek reaccreditation is just the lack of funding support. So with the Public Health Infrastructure Grant Innovation Funds, OPA wanted to see if there was an interest by locals to seek pathways, initial accreditation, or reaccreditation if financial assistance was available. A survey was sent out to health departments, and 50 health departments expressed interest in taking next steps towards maintaining or achieving accreditation status. So OPA staff are actively working on establishing a contract with PHAB that will allow for PHAB fees incurred by local and tribal health departments in Wisconsin to be paid directly by the Division of Public Health Infrastructure Grant. Next slide, please. And so this brings me to our last overview of one of our accreditation support pieces is results-based accountability or RBA partnership cohort. So results-based accountability or RBA is the performance excellence model framework that is utilized by the Division of Public Health. PE or performance excellence is an integrated approach to organizational performance management that results in improving value to customers and partners, improvement of organizations' effectiveness and capabilities, and learning for the organization and for the people in the workforce. So to expand the knowledge of local and tribal health departments, an opportunity to join a cohort for results-based accountability was offered. And local and tribal health departments in partnership with a community-based organization are participating in a 2-year cohort to learn and incorporate the RBA framework within their performance management work. Funding is providing RBA certifications for a staff person at the local or tribal health department, as well as a community-based organization. Previously, we held a cohort similar to this that was specifically for local and tribal health departments, but was limited as many of the initiatives that are successful out in the community and are a little more beneficial, I would say, when the community-based organizations are also part of it and understand, the framework and the goal. So this time around, the cohort focused on partnerships and initiatives with a local and tribal health department and a community-based organization. Next slide, please. So just to summarize, the objectives of the RBA partnership cohort include building organizational performance management capacity, sharing with and learning from other health departments, and informing best practices around supporting and collaborating with other partners. So the expertise provided is beneficial to alignment and reinforcement of requirements with the with PHAB reaccreditation standards and measures, as well as DHS 140 reviews or the requirements of local health departments, which also does contain performance management and quality improvement aspects of it as well. So I think that wraps up my time. Thank you.
Thank you for sharing with us, Krista. And that moves us into Nebraska statewide strategies. With us today, we have Celeste, who is the Performance and Improvement Manager at the University of Nebraska Medical Center College of Public Health. And she provides training and technical assistance to public health departments across Nebraska, where her work focuses on supporting them in meeting public health accreditation standards and measures. So with that, I will turn it over to you, Celeste.
Hello, I'm excited to be here with you today. As Ashley said, I'm Celeste Ehrenberg, the Performance and Improvement Manager at the University of Nebraska's College of Public Health, Office of Public Health Practice, or OPHP for short. Today, I'll be sharing Nebraska's learning community approach in supporting and advancing the national standards and measures for public health accreditation. Next slide, please. At OPHP, I work closely with all public health departments in Nebraska by providing collaborative learning experiences, training, and technical assistance as they strive to meet PHAB standards and measures. My work is supported by Nebraska DHHS Division of Public Health through the PHHS Block Grant from the Centers for Disease Control and Prevention. Next slide, please. For context, as displayed on this map, many of Nebraska's local health department jurisdictions cover multiple counties. We are a decentralized state. I work with our state health department, Nebraska's 19 local health departments, and 1 tribal health department. Currently, 9 Nebraska health departments are accredited, with 4 recently becoming re-accredited. Most of the other health departments in Nebraska are engaged in the accreditation process through pathways recognition, initial accreditation, or readiness assessments and training. The cornerstone of our statewide collaborative learning environment across Nebraska's public health departments hinges on supporting self-efficacy and fostering spaces for idea sharing and resource exchange. Next slide, please. Because collaboration is central to my work, let's first establish a shared understanding of what community of practice is. I'm defining it here as a group of public health professionals who deepen their knowledge and expertise by engaging with each other on a continuous basis. This table here highlights the difference between a community of practice and other learning structures. The cultivation of our community of practice is a practical way to manage knowledge as an asset. Knowledge is dynamic, not static. It evolves with data and innovations and challenges. A statewide collaborative learning approach enables health departments to continuously adapt and advance in meeting national accreditation standards. Next slide, please. An essential part of this learning community are the interactions I have with the accreditation coordinators in each health department, because they are my primary source of relationship and contact. Regardless of where a health department is in the formal accreditation process, all health departments in Nebraska have a team member assigned the responsibilities of accreditation coordinator. On this slide are some key learning opportunities that I provide. Monthly sessions focus on topics such as QI projects, succession planning, and evaluation basics. Quarterly communities of practice shifts. The quarterly community of practice, their focus shifts annually. Last year, we did a readiness assessment community of practice, and this year we're diving into specific PHAB measures as our community of practice. The reaccreditation communities of practice, they vary between structured learning opportunities or a facilitated discussion. It's based on what the health departments tell me they need, or they tell each other they need. Additionally, we have regional communities of practice. Those are under my guidance, but they operate independently, with health departments annually rotating the facilitation responsibilities. Beyond facilitation during the gatherings, we provide services that support accreditation efforts, including connecting health departments to each other for peer learning and sharing of best practices. Once a year, I also host an in-person half-day session for the accreditation coordinators to attend to help strengthen their connections with me and to each other. Next slide, please. An essential part of our learning collaborative is to use data to shape the offerings. This is some key data points from 2024, illustrating the level of engagement and collaboration across Nebraska's public health departments. I'm just going to pause for a moment to give you time to read if you need it. Next slide, please. So I continuously evaluate our work so that I can improve the approach. After every training, I send out an evaluation with these key questions, and then I hold routine conversations with accreditation coordinators, in part to gather qualitative data. Then annually, I send out a survey to assess the year's impact and identify future needs. Next slide, please. Okay, so how did we build this collaborative learning community? Essentially, we focus on two key roles, that of content manager and then administrator. As a content manager, there are two components. The first is knowledge management. This means having the information, tools, and resources, or knowing who does. Or my favorite, which is creating tools and resources needed. For example, I facilitated a work group made up of several of the accreditation coordinators across Nebraska to create a tool that's tailored to Nebraska to assist with documentation of enforcement authority and unified messaging. The second component is that of subject matter management. Staying engaged and curious always allows me to continuously build relationships with those who can provide the knowledge. For example, the monthly trainings that I facilitate, sometimes I'm providing the content and I'm the expert, and other times I'm inviting in subject matter experts to provide the content. This could be, for example, someone from PHAB's team comes in, or I ask a staff member at a Nebraska Health Department who is a subject matter expert in an area, or a faculty member from the College of Public Health. I also help connect the health departments to subject matter experts for specific needs within their department, such as public health ethics exercises or developing a career ladder. Next slide, please. So the role as administrator, there are three components that I focus on. The first is membership management. So that's knowing who I am connected with at the health department and then being able to connect them to each other. This includes the responsibility of building and nurturing the community by creating trust and autonomy. The second component is the nuts and bolts of this role, otherwise known as logistics management. I generally start planning a year in advance, or that October, and then I set up all the calendar invites. I provide the Zoom links, I record the trainings, I have a YouTube channel, I send all the follow-up materials, and I reach out for check-ins periodically. Next slide, please. And the final component as administrator is that of performance management. So we set strategies, goals, objectives, and performance measures based on the evaluation results so that we can create a continuous feedback loop that ensures flexibility and responsiveness to participants' needs. Next slide, please. All of the data collected through a multitude of means is incredibly valuable. However, the most meaningful measure of success comes from witnessing how the accreditation coordinators engage with and support each other. They collaborate, share ideas, and build relationships that strengthen Nebraska's public health system. They popcorn off each other and brainstorm during learning opportunities, and they are always willing to share their documentation and experiences with one another. For example, I recently met with the past regional community of practice facilitators to gather lessons learned. Their enthusiasm for reconnecting was inspiring. At one point, an accreditation coordinator jokingly said she only came to the meeting because she wanted to catch up with the other coordinators. In the end, though, not only did they refine our regional model, but their ideas also reinforced the importance of peer-driven learning. Next slide, please. I'm incredibly grateful to help facilitate this collaborative learning community. It's rewarding to get to support Nebraska's health departments as they work together to meet national public health accreditation standards more effectively than they could have alone. On this slide is my contact information. Feel free to reach out, and thank you for having me here today.
Thank you, Celeste. So, and as Celeste was talking, PHAB has also recently launched our accreditation learning community guide within the PHAB Learning Center. So that course is available to health departments and can help and contains information to support the development of those learning communities within your state or your region and area. Slide. So next we have Missouri's going to present on their statewide strategies. We have Ashlyn Sherman, who is the health planning coordinator at the Missouri Department of Health and Senior Services, working with the Office of Performance Management. In this role, Ashlyn also serves as the accreditation coordinator, responsible for organizing the department's accreditation process through the Public Health Accreditation Board. And I will turn it over to you, Ashlyn.
Thank you, Ashley. As Ashley said, I am the health planning coordinator and the accreditation coordinator for the Missouri Department of Health and Senior Services. And today I'm going to talk about our approaches to supporting our LPHAs or local public health agencies in their journey towards accreditation. So on this next slide, it's a brief overview of our systems building efforts overall. We do have 115 LPHAs in the state of Missouri, and we are a decentralized state. So we have multiple prongs in increasing the public health system within Missouri, which includes data modernization projects, workforce assessments. We are also in the beginning stages of our foundational public health services costing and assessment project, and we're supporting our LPHAs and accreditation activities. Within the accreditation support for LPHAs, we also have multiple avenues that we're utilizing to assist our locals. We are providing cost reimbursement for any accreditation related activity. So this could be things such as purchasing a performance management system or creating a strategic plan. We also have contracted with the Missouri Public Health Institute to provide technical assistance and accreditation activities. And what I'll mainly be talking about today is that we have contracted directly with PHAB to provide the readiness assessment for all 115 of our locals. So on this next slide, it's an overview of the readiness assessment project timeline so far. We first started in the fall of 2023, and that is when we contracted directly with PHAB to provide the readiness assessment to any of our LPHAs who would be interested. And PHAB first hosted the first training in December of 2023, and we had 27 LPHAs attend. We also did tie some incentive funding, some general revenue incentive funding to attending the training on the readiness assessment, and that just helped to increase some interest. We've had great experience working alongside PHAB throughout the process. A huge shout out to Emily France, who's on this call as well. And she helped to present jointly at our Missouri Public Health Association conference in the fall of 2024 on the opportunity. And this helps to boost the interest as well, so much so that we've extended our contract out through 2026. And then most recently in December 2024, we've had 41 LPHAs submit the readiness assessment. So overall, we're pleasantly surprised by the participation rate that we've had so far. On this next slide, I just want to touch on some of the benefits of the readiness assessment and providing it for our LPHAs. It is designed to provide the health departments the opportunity to receive feedback on readiness and to ask questions of PHAB about the measures. So it helps as a first step for LPHAs to become familiar with the standards and measures should they choose to pursue pathways or initial accreditation. LPHAs that complete the readiness assessment do receive a detailed report covering the 10 essential public health services and FPHS, which the standards and measures, as well as the readiness assessment and pathways are based on, as well as responses to any questions raised by the health departments and guidance on next steps. So the LPHAs could use the results to benchmark their performance compared to their peers. It also allows the LPHAs to evaluate their major plans for readiness and alignment, which can help to strengthen processes and preparedness, and it helps to build support within and outside of departments. So the LPHA could utilize results to advocate for additional investments and communicate about the department's strengths or opportunities to staff, their governing entity, or their community as a whole. On this next slide, I just want to share some successes. 92 out of 115 LPHAs have attended training, which is the first step in the readiness assessment process. And this is a huge number for us in milestones, so we're very proud of this. And so far, 34 of our LPHAs have fully completed the process, meaning they filled out the survey, submitted the RA to PHAB, and have received feedback from PHAB. And finally, 8 LPHAs out of the ones who have fully completed the process have committed to applying for pathways or initial accreditation afterwards. So we're really happy to share the success of this opportunity so far. It surpassed what we initially thought the participation rate would be. And on this next slide, I just want to touch on how this is beneficial for us at the state as well. So we do receive an overview of the completed readiness assessment results, which helps us to identify areas of assistance that we could focus on in improving our support to our locals. So some examples are here on the slide. What we've learned so far is that domain 4 is the highest scored domain, which is strengthening, supporting, and mobilizing communities. On the other hand, so far domain 9 is the lowest scored domain, which includes improving and innovating public health functions through evaluation and research. And when we dig slightly deeper, the highest ready measures of those completing the RA are managing financial systems, maintaining a human resource function, and actively participating in health coalitions. And then the lowest ready measures include the strategic plan, performance management system, and implementing quality improvement projects. So we can utilize this information at the state to look at creating resources and training to address the areas of opportunity, such as providing training opportunities for quality improvement, or working alongside Missouri's Public Health Institute to create a strategic plan training or template. So overall, this information is beneficial for us so we can understand how to better support our LPHAs and provide focused training or resources where it's needed and would be most beneficial. Finally, just a quick overview of our readiness assessment initiative alongside PHAB on the next slide. We do want to point out that it is free and voluntary for our LPHAs. So we are utilizing FIG funds to cover the cost so that the LPHAs don't have to fund it themselves. The tool is completely online, and participating does not mean that the LPHA has to apply for accreditation afterwards. The project also offers training and office hours to all 115 LPHAs that PHAB does provide. And providing this opportunity helps to increase awareness of key public health areas based on national standards, which will aid in improving our public health system overall. And finally, PHAB does provide LPHAs reports on their readiness, and then the state receives overview information. So this helps LPHAs in utilizing the feedback in their communications, and then it also allows us at the state to identify where further assistance is needed to support our locals. And PHAB has been very involved in the process. They speak at our LPHA calls, attend cohorts, and provide information to our LPHAs directly in regards to this opportunity. So overall, it's been an extremely beneficial opportunity for our state and our LPHAs, and we're looking forward to the continuation of the program. Thank you.
Thank you, Ashlyn. So we've heard about a lot of the work the states are doing, and now we're going to talk a little bit about all the resources you've heard about that PHAB has provided and where you can find these as well. So first, we have our statewide documentation tip sheet, which you heard Rich and Emily talk about earlier. And this is found on our website and helps highlights that PHAB is working with accredited state health departments to identify those statewide documents. The tip sheet's available, and even local health departments could use it to work with their state and help identify those measures where documents might be available. We also have our service and resource sharing approaches, and this is really thinking about how to deliver services through resource limitations. This is through resource sharing, joint purchasing power, regional and statewide models, joint plans, and much more. As you heard mentioned, we have our PHAB readiness assessment that is available if you join our readiness and training. And for states that are accredited, there is the reaccreditation readiness assessment that is available as an annual report. We have our state and territorial peer network, which brings together accreditation coordinators in various states to work through their peer network and learning. We have document templates. So we have a workforce development plan. We have a PNQI plan, and both of these have user guides that are available for health departments to access. We are working on a strategic plan one as well. There's the tools for transformation, which you heard mentioned earlier. This includes our capacity and cost assessment, which is developed to align the national FPHS framework in building from past 21C states. We have the calculator to support health departments plan for staffing needs. This is really used for health departments under 500,000. Population size. Of course, we have the readiness assessment as mentioned earlier. We have fact documents, which are found within the Learning Center. So health departments that are in process with PHAB are able to access these. And of course, we have our inboxes such as Ask PHAB and PHAB TA. And we are always welcoming you guys to send in questions and ask these so that we can provide the responses to you and really make sure we're addressing the needs in the field. And I will turn it back over to you, Rena. Okay, PHAB products and services. Again, we have some of our consultation and facilitation services. Rena, I see you come off. Are you going to talk?
Yes, thank you. Sorry about that. It took me a minute to unmute my my screen. So thanks everyone. And yeah, just wanted to transition then into sharing a little bit more about some of our service offerings that we're happy to talk with y'all a little bit more about around things related to accreditation readiness and accreditation supports. Around service and resource sharing, and really thinking about how, as we're thinking about continually enhancing efficiency and effectiveness, how we might better deliver services, how we might think about how resources can be shared differently to increase efficiency, effectiveness. And I think that's across, health department to health department, but also really looking across statewide systems, which is a lot of what we've been talking about in terms of resource and service kind of supports and sharing to enhance approaches to accreditation. Supports around foundational public health services, including some of the assessments that were mentioned, visioning efforts around how do you kind of plan for what the future of your health department or your system could look like. And then cross-cutting supports in areas around workforce, QI, performance management, innovation, as Ashley mentioned earlier. So wanted to name some of these, and we're always happy to talk about how we can continue to support all of y'all in your efforts. So with that, we're going to transition into Q&A, and looks like we have some great questions that have come in and a good amount of time. So I'll ask our panelists and PHAB staff to come back on camera. And I'm gonna start with some of our questions that have come in, and just want to offer the thank you again to all of y'all who have presented and facilitated today. Awesome information. Really appreciate y'all sharing what you're doing in your systems. And want to also acknowledge that PHAB is here to support all of you who are on this call today, and really want y'all to be successful in your accreditation efforts, and always willing to strategize on how we can best support you moving forward as a health department and as a system. And we can work with you on areas around like documentation that were talked about, around strategizing around how you stand up a learning community and best ways to implement that. Exploring statewide assessment approaches, and more. And then just wanted to highlight a couple of questions that have come in around ideas for enhanced continual thinking around CQI for reaccreditation in centralized states. And really just want to name, and we can dive into some specifics as we move into the discussion. But again, we're here to support, and we're always exploring and literally exploring some ideas on how we can continue to ensure we're helping think about different approaches to support burden and embracing that culture of continuous quality improvement. So things like approaching reaccreditation through different models, and we're going to be exploring some pilots around that in the future. And then other structures or ways to implement accreditation within centralized states as well. So please do reach out to us. We want to strategize from you, and we'll know if you're interested. So wanted to throw that in there. And then I'm gonna start, and I'll throw this to maybe Emily or Ashley, and then invite others to join in. And Emily, I know you shared a little bit about this, but have a couple more questions around it. Could you share a little bit more around what is statewide documentation process, and what does that look like, and how do folks connect with us on that?
Absolutely. So I think the best example is if all the locals and possibly tribal health departments within the state use the same communicable disease manual or other document. Rich mentioned the Montana infectious disease control system, the system that they use for tracking. PHAB will conduct a review and approve it as statewide documentation if it meets all of the requirements and the standards and measures. And then those local health departments or tribal health departments, if that document applies, do not need to resubmit that same document over and over again. So it creates a huge efficiency, I think, not only for local health departments, but also on PHAB's internal end in terms of the review process. And if you are interested in exploring that option, first, if you're local or tribal health department, we would invite you to engage with your state health department. Currently, statewide documentation only applies to accredited state health departments. So make sure that they're part of that discussion. We've also had some states that have engaged their learning communities in identifying those documents. So actually from kind of the ground up, how can we work together and identify what could be submitted? And then also feel free to reach out to Ask PHAB at phabboard.org. I know that email is in the chat today. We're happy to go over some of the statewide documentation in that tip sheet that's on our website. We also have some additional examples of specific measures that could be submitted for consideration. So feel free to reach out to us. We are more than happy to go over that process.
Thanks, Emily. Is there anyone else who'd want to jump in? All right. The next question I would throw out to, I'm going to throw it out to the group, and please jump in around what have you seen as the benefits to taking this system-wide or statewide approach, which is different from kind of every individual health department pursuing this individually. So what are some of the benefits you've seen? And then likewise, what are some of the challenges you've experienced? Krista, yeah, Megan, you came off mute. Go ahead.
Yeah, I can jump in, so we're not just staring at each other. So in terms of the state of Montana, some of the benefits have been just capacity. So a lot of our jurisdictions seeking either pathways or accreditation don't have a ton of capacity towards submitting documentation. And so by submitting statewide documentation, it does fill that gap. And hopefully we're hoping to expand statewide documentation in Montana. So that's kind of an initial benefit. In addition, some of the kind of difficulties that we've seen for folks either pursuing accreditation or pathways is one, capacity. It feels quite daunting for folks, especially if you have a health department of 2 FTEs to undertake something like this. In Montana, we actually do have a health department with 1 FTE that is now in our pathways program. So I think it's kind of building up your system so that they feel comfortable in order to do this. In addition to some barriers is cost. And so through FIG funding, I know our state's been able to help provide the cost compensation for both accreditation or reaccreditation efforts in some cases, and then for pathways to recognition. And then the third barrier is just kind of understanding what is going to be the benefits of accreditation in pathways. I think that's a gap. I know in Montana, even some of our reaccredited health departments are kind of asking, what does this buy us? This is a lot of work and a lot of money that's going to it. And so what are we getting out of it? And so at the state level, we're looking at how can we better align our funding opportunities with these PHAB standards and measures related to the foundational public health services. And I don't know, Rich, if you have anything else to add.
No, Megan, I think you covered it. I appreciate that. You jumping in.
Thanks, y'all. And other Celeste, Ashlyn, Krista, anything you would add to that?
Sure, this is Krista. I can just add that I think one of the benefits has been for some of the health departments that went through initial accreditation a while ago, they got a lot of questions from the PHAB site visitors that reviewed them about systems that were really statewide. So Wisconsin's electronic disease surveillance system and Wisconsin immunization registry, that they were asking some fairly technical questions that the local health departments don't know because they don't maintain those systems or those sites, or asking about our state lab of hygiene and how they access those, and how they access that from a perspective of essentially the what the agreement is. So this was really an opportunity for us to submit things on behalf, or to PHAB for approval, so that we could assure that we were providing sufficient information for what's required for the standards and measures. So I think that's been a benefit, and this was something that locals have asked us for quite a while. You know, why can't the state provide this for us if you're doing this for everyone too? So I think this is a really good opportunity for us to be able to do that. I did see since I'm off mute, I do see another question in the chat. Do you mind if I take that from Wisconsin's perspective? Okay. So the question in the chat is, when do state health departments submit this documentation if they're at the point of submitting for their own reaccreditation? So that's something that we actually, the timing for us exploring when should we do this statewide documentation? And we had pretty early conversations with PHAB for a while. We were kind of tossing this around. We were keeping them up to date on our expedited review process, or that was something that we were considering. And they had shared with us the potential opportunity for statewide documentation, which kind of actually coincided with our timeline for statewide reaccreditation. So the submitting documentation to PHAB was a project that we'd had out there for a while. And we thought if we waited until we had our own state, the documents that we were submitting for reaccreditation, that we would have a better sense, or we'd be able to utilize some of those pieces and modify them. And at least in our experience, that wasn't the case. It was very difficult to repackage what we submitted for our Division of Public Health reaccreditation efforts. And essentially, we started over with the project so that we could package the materials for the statewide evidence process. So at least in our experience, we were not able to, I think we got some good ideas about what we could exactly submit, or by looking at our reaccreditation evidence, but we really needed to go back to the drawing board to really reframe and rethink, if we're providing evidence that shows that all health departments in the state are using this, like what do we need to show versus what we were showing for our own reaccreditation. So just sharing that was the perspective, that was our experience.
Thanks, Krista. That's helpful. And Emily or others, is there anything you would add to that question from a general standpoint? Okay, I'm going to transition us to the next question. And Emily added in some links here around, are there resources or webinars for local accreditation efforts? So take a look at that response and just verbally kind of acknowledging, yes, we continue to have webinars and education and training events that you can find on our website, and both live and on-demand courses. We also have a variety of technical assistance offered through our public health infrastructure grant role as a FIG TA provider. So you can access those on the phinfrastructure.org or PHAB's website, and always reach out to us if you're looking for any of those. And then if you're looking for something more specific or tailored to your health department, we're happy to talk about what that looks like and talk through a scope of work based on that. So thanks for that question. And then I'm gonna segue into, there's a couple of questions we received around sustainability. And in particular, thinking about how some of these efforts are being funded right now through the infrastructure grant or other kind of specific funding sources. And really just the idea around these efforts are really important, and how do we continue to sustain it? And then what's the kind of next step from here? So I would invite our presenters to share a little bit more about what are you thinking about related to sustainability of these efforts as you move forward, both like today and what you're planning for in the future.
I can speak to that if you'd like me to start. So that's kind of, in my opinion, like the beauty of having a statewide learning community that we have. My work is supported through the Preventative Health and Human Services Block Grant. And if that went away, there is still what happens between the health departments. I merely facilitate it. I know who has the documentation to go to, but they are so good about contacting each other. This learning community will reach, I ask a question every year on the survey, are you comfortable reaching out to another accreditation coordinator? And it's always like, yes, strongly agree or agree. So if you start with the foundation of starting to build a community of practice, which any health department could take on, and then supplement it with ask PHAB questions, reaching out to PHAB, you could get something that is close to what Nebraska does, without funding. The more of the role I take on besides facilitating relationship building is very services, documentation reviews, mock site visits, reach out and like, if you want to meet with me every week to go over something, look at your narratives, we'll do that. But the collaboration that the health departments have, they have the knowledge. They just need to know who to turn to. And that is sustainable. Once you build it, it will sustain without funding. I am complete.
Thanks, Celeste. Other thoughts from our other presenters?
Yeah, I will briefly speak from Missouri's perspective. I think part of what we hope that comes out of the support that we're offering all of our LPHAs in terms of the myriad of ways, and you can go through accreditation right now, is that our LPHAs can understand the importance of it themselves and utilize some of this to advocate for funding within their own areas. But also we are in the process of doing the Foundational Public Health Services costing assessment. And one of the goals of that is utilizing the data and information that comes out of it and going to our legislature and stair-stepping funding so that we can support some of these initiatives ongoing throughout, regardless of grant or not, it's just general revenue funds.
Thanks for that, Ashlyn. All right, I'm going to throw another question. And I know some of y'all spoke to this a little bit as you were going through your presentations, but what processes did you use to really decide on where to focus your efforts? So that it was a learning community and then the topics for the learning community, or that statewide documentation was really the approach, or, we wanted to start with this assessment. How did y'all kind of go through the process of developing what the approach was that you were going to take and understanding needs from across your system.
I can start as well if you would like.
Sure.
So I stepped into this role about a year and a half ago. So it has been part of Nebraska DHHS in some form for quite a while. I think 8 or 10 years. Through our office, it's been about 5 or 6 years, and so this framework was already in place when I stepped into this role. So, but in the last year and a half, what the way I've decided to structure it, the way I structure it is through the annual surveys. I ask them, here are a range of topics. What do you need help on? And then we prioritize, and I work with Ashley to identify subject matter experts, and I work with the health departments. You know, the health departments are full of subject matter experts on EOPs or communications or the value of public health and how to communicate that. Or we have 9 accredited health departments. So we looked there, and then reaccreditation, that was already a community practice that was meeting, and then honed it there too. Like, do you want learning opportunities as well? Do you want PHAB to come in and talk about the difference between version 1.5 and version 2022? And so we have that there. And then the regional community of practices also came out of a pilot and went so well that we sustain them quarterly too. And then last year is when we started the in-person annual event, we asked the health departments what they wanted, and then they told us, and we went out and tried to find those resources to meet them where they're at. This is the first, when I stepped into the role, is when we really started also then working even more closely with PHAB, with looking for subject matter experts, which I think has helped a lot too with our relationship building between PHAB and our health departments.
Thanks, Celeste. Yeah, Ashlyn, please jump in.
Yeah. So in regards to the readiness assessment, I will give a shout out to Brenna Davidson, who is going to help me answer this question. But we basically picked the readiness assessment because it was a full package solution. So the only barrier was funding, and we were able to remove that barrier for our LPHAs thanks to FIG. But then we also provided multiple, like a holistic view of accreditation. So we are contracting with the Missouri Public Health Institute to provide technical assistance for accreditation services. We were utilizing grant funds to provide reimbursement for any activity related to accreditation. So we kind of tried to remove as many barriers as possible and use this time to help build up that public health system in the hopes that we could just increase preparedness and readiness and also awareness of accreditation moving forward.
Thanks, Ashlyn. Okay, we're getting close to the end of our questions. I'm going to throw out 1 or 2 more, and we have more time if y'all have more questions too. And some y'all shared some of this as you were going through your presentations, but could you share a little bit more about what you're hearing from your system around reaccreditation and how some of the work that you're doing is addressing kind of where there's like issues or gaps coming up with reaccreditation preparation efforts? Might toss that to, how about Rich or Megan first?
Yeah, can you hear me?
Yes, we can hear you.
Okay. Yeah, so for reaccreditation, what we're doing is we have a reaccreditation network where we meet on a monthly basis and just discuss some of the challenges, some of the documentation we're going through, and just the process. Like last month, we just went through what a site visit looks like through PHAB and stuff like that. And it changes on a month-to-month basis of what we speak about, but it's just a way for us to just gauge where everybody is on their journey, see what challenges they are. Hopefully we can address them before and from the state, and just kind of troubleshoot anything they're going through and work through. And again, like I said, Joshua Pecora has attended a lot of those meetings and is able to get an insight from PHAB to them, trainings, etc., like the statewide documentation pilot that you guys have. There is a training that they've all now gone through. I think it's on PHAB. It's on the learning, PHAB's learning website. And there's a course that they can go through, and he's helped that. And that's kind of what we're doing just to make sure that they're engaged.
And then just to add on to that, in terms of the specific hurdles, and I know we touched on this previously, is really the cost of reaccreditation for what health departments are getting out of it. And we can tell them how beneficial it is, and they can see how by understanding these standards and measures and having the documentation that it does help their delivery of the foundational public health services. But when it comes down to dollars, that's really what they're looking at. And so something to think about, or that we're thinking about at the state level, is really aligning our grant funding with those efforts so they can see the value in it. And hopefully that's something that occurs at the national level too. In regards to the funding question earlier, I think we're all really hoping A2 sticks around. But in addition, with these hurdles and funding and the unknown of the future, I think it really comes down to having strong partnerships within your state. And so if you have other organizations that can pick up, if the state health department, for example, is no longer able to, then it can ensure the continuation of these efforts.
Thanks, y'all. And yeah, continuing to highlight too, I think we're continuing to explore additional ways that we can evolve reaccreditation as well, and looking into some pilots and things like that as we move into the future. So always happy to talk with folks who are interested in just strategizing or sharing your thoughts, or if you want to consider participating more fully in those in the future, we'd be happy to explore conversations with you too. And then likewise with our service and resource sharing supports, especially as we think about how do we work more efficiently and effectively, and really think about how we're delivering services collectively that can enhance efficiency and effectiveness, can kind of take limited resources in a broader way, have a variety of those resources available that and we'd be happy to talk with y'all too about how thinking about service sharing approaches to really enhance kind of efficiency and effectiveness. Okay, I'm gonna ask y'all one more question, and I invite everyone to jump in. I might just pepper it around, including our PHAB speakers as well. What are one or two tips or lessons that you've learned that you'd want to offer to the folks on the call today who are considering one or more of the statewide approaches that we've shared today? So I'm gonna pepper it around, and apologies in advance because I know that it's off the cuff here, but Krista, I'm gonna start with you here.
Sounds great. Thanks, Rena. I think one of the things that Wisconsin learned, especially with the statewide evidence process, is so Kristen Kelm, who I mentioned during my section, she's one of our public health nurse consultants, and she used to work at a local health department in Wisconsin and was very connected to their accreditation journey as well. So she was able to use her like state and local experience to really think about what evidence what would this look like? So I think that was really a benefit, especially in a decentralized state, excuse me, to have somebody that kind of is familiar with both state and local, and like what local operations look like, and being mindful of kind of the user experience of some of the programs that we have. I'll also just say, I think one of the other pieces that was really helpful is that we actually we haven't done this in a while, but we did set up kind of quarterly calls with PHAB just to talk through, because Wisconsin does have quite a number of, or at least did have quite a few health departments that are locally accredited. So it was helpful for us to share ideas, and PHAB was sharing what they were hearing. We were sharing what we were hearing just about folks, staying accredited or reaccredited, and what might some challenges be. So it really helped us kind of navigate and decide where we should put our time, effort, and attention as well. So I would say finding someone that is passionate too about accreditation, and having them kind of help navigate or bring ideas forward, and serve as the lead in this area has really been helpful.
Thanks, Krista. I'll toss it to Megan.
Thanks. I think that within these efforts, it's really important to know that you can pick a structure and you can have a lot of meetings and planning, but really it comes down to, is your system ready to pursue these efforts, especially in a decentralized state? And so what I've learned is the importance of really being advocates for health departments and taking time to meet with them one-on-one to listen to their concerns, but also to build their confidence. And so we're hoping to really leverage the results from our foundational public health services assessment to show folks that they're doing better than they thought they were, and that they're almost there towards pursuing these efforts. And with our team's help and support, they can do that. And so I think it really comes down to just encouraging folks, and don't doubt your system and their abilities. I think we found that our system is capable of more than we could have ever imagined. And right now, we're hoping to really harness that and transform Montana's public health system.
Thanks, Megan. Ashlyn.
Yeah, so I will say firstly that if you're able to, obviously removing some funding barriers is a great way to incentivize participation, and we've definitely seen that firsthand. I will also say that utilizing the data that we've received in order to tailor specific needs and requests for LPHAs has been really beneficial for us and helpful. So instead of having to offer kind of broad trainings, we now have data that shows that we don't need to maybe provide resources on every single domain, but rather target specific areas that are opportunities that we've recognized. And finally, I just want to kind of push people to use PHAB as a resource. We've really been grateful for all of the communication and information we've received from PHAB, and also PHAB providing that directly to our LPHAs has been incredibly beneficial for us. So just utilize their services.
Thanks, Ashlyn. Celeste.
I think just really encouraging health departments to turn to each other, regardless of where they're at in the accreditation process. For a long time, Nebraska health departments have been striving to meet national standards and measures, but weren't necessarily pursuing formal accreditation in any form. But that wasn't a barrier for them to still come to the communities of practice and listen to how to do things, why to do things, start to dip their toes in, because they're meeting the foundational capabilities, right? They're striving to meet those national standards and measures. And so when we had the readiness assessment community of practice, we had health departments that are going through, like, there are accredited health departments attending to listen to how the health departments that were now going through it, what they were learning. So they can all kind of turn towards each other regardless of where they are at in the process. We're actually very close to having all of our health departments in the formal process, and it's only been in the last year or so where I think we have 4 or 5 almost through initial, which I think happened because they can turn towards each other. So my recommendation would be, if you are a health department just thinking you want to start to make sure you're meeting the national standards and measures, to reach out to other health departments, and you're stronger together than you are alone. So I'm complete.
Thanks, Celeste. And Rich, from your end.
No, I'd have to piggyback on what Megan shared. Really advocating for the health department, showing them that they have the potential to do it, and building the trust and working hand in hand with them, I think is super important. And just like others have shared, just the connectedness and making sure that they realize they're not in it alone, whether it's the state health department helping PHAB or other local and tribal health departments on the journey, so they're all in it together. So yeah.
Thanks to our presenters. Ashley, from your end.
I'm just going to kind of build on what everyone said. Use your resources. PHAB is here to help. Utilize that Ask PHAB inbox. If you don't know where to start and really how to approach it or get your community together, we are here to help and can help provide those resources. And it's not such a heavy lift on the local health department to do that.
Thanks, Ashley. And Emily.
I think Ashley said what I was going to say is that PHAB is here to be a resource. So I'll just add that a stitch in time saves 9. If you feel you're floundering, reach out to us. Now you have the names of some of the state contacts from today's call, and obviously other learning communities. The public health world has a lot to learn from each other. So thank you so much.
Great. Thank you all so much. Really, really appreciate everyone for all of your insights and sharing kind of specifics, both kind of what's working well, challenges, and for all the questions that came in as well. So thank you all again to our presenters and for those of y'all who were able to join. Invite y'all again, as everyone has said, to connect with us, connect with each other. You can find some ways here, reach out to Ask PHAB or our PHAB TA at PHAB board, email addresses. And encourage everyone to please take the evaluation so we can continue to improve and understand what else would be helpful for y'all for future events. You can either use the QR code here or the link that Lydia put in the chat. So thank y'all again. Really, really appreciate your time. Thanks to our presenters, and we'll catch y'all on the next one. Thank you.